it wouldn't.
Dear ladies and gentlemen, dear colleagues, my name is Michael Fuchsjäger and I'm the President of the European Society of Radiology. Welcome to our table talk on insights into Vienna's history of medicine in the context of the pandemic, from the Rector of the Medical University of Vienna. At this point, I would have welcomed to the stage a highly valued colleague, the Rector of the Medical University of Vienna, Professor Dr. Markus Müller. However, as he was called away on a business trip in his duty to the public and his important work for the Republic of Austria, he has agreed to record his lecture so that we can still gain insights into the important matters he is dealing with. Rector Professor Müller graduated from the medical faculty of the University of Vienna in 1993. Today he holds 2 medical specialty degrees in clinical pharmacology and internal medicine. In 2004, he became professor and head of the medical department for clinical pharmacology at the Medical University of Vienna, and in 2011, its vice rector for research. Professor Müller received international rewards for his work on the development on clinical microdialysis and his internationally acclaimed expertise in the field of clinical vaccine development. In 2014, he was named chairman of the Data Safety Monitoring Board of the World Health Organization Vaccine Program, WebCon. In 2015, he became president of the Medical University of Vienna, and in 2018, the president of the Austrian National Institute of Health. An impressive career for an impressive colleague. I'm honored and happy that Rector Müller is part of our Table Talk series at ECR 2021. Of course, Rector Müller would not have been my only guest in today's session. Therefore, I'm thrilled to introduce you all to 2 further highly esteemed radiologist colleagues and friends. First, my esteemed colleague and friend live from New York City, Professor Dr. Hedvig Hricak. Good morning to you, Hedy. Professor Hedvig Hricak is chair of the Department of Radiology at Memorial Sloan Kettering Cancer Center. She dedicated her career towards the advancement of radiology and oncology and has made incredible contributions to these fields with her expertise in cross-sectional anatomic and molecular imaging. Professor Hricak is a strong believer that medicine knows no borders, and throughout her career, she has done her best to promote international collaboration in medicine, particularly with respect to education and research. She's a powerful advocate for gender equality in radiology, having organized the Women in Focus program 2 years ago during ECR 2019. Professor Hricak was married to the late eminent radiologist Alexander Margulis, an outstanding person we will hear a great deal more about later on in this session, so stay tuned. And I'm pleased to welcome here in the studio Professor Dr. Christian Herold, Chairman of the Department of Biomedical Imaging and Image-Guided Therapy at the Medical University of Vienna, Vienna General Hospital. He also acts as Director of the Medical Imaging Science Cluster at the Medical University of Vienna and is a faculty member of the Department of Radiology at Johns Hopkins Medical Institutions in Baltimore, USA. Professor Herold is widely respected as a thoracic radiologist who is committed to passing his knowledge on to the next generation. He served as president of the European Society of Radiology and was ECR Congress president in 2007. On a personal note, Professor Herold was my first radiology mentor and the senior author of my very first scientific publication. Thank you, Christian, for joining us today. As already mentioned, Professor Markus Müller is rector of the Medical University of Vienna, an impressive institution, worldwide acclaimed and rich in history. You might ask yourself now about the connection of the Medical University of Vienna and Alexander Margulis. Rector Müller will kindly help us out here with some interesting information.
So good afternoon, everybody, and thank you so much for having me. I was asked to give a short presentation about some historical aspects of medicine in Vienna in honor of Alexander Margulis and his family on the occasion of his 100th birthday, which we are celebrating this year. Now, our university is very old. It was founded on the 12th of March, 1365. And it had its glorious days in the 18th until the beginning of the 20th century with the so-called First and Second Vienna School of Medicine. All this came to an abrupt end, again on the 12th of March, 1938, when Hitler Germany invaded Austria, and 2/3 of our faculty were expelled for racistic and anti-Semitic reasons. And this has inflicted irreparable damage to our university, and it took many decades until we could overcome this severe trauma. Now, the heyday of our university started with the building of the Vienna General Hospital, which was erected in 1784 by the Emperor Joseph II. It was a copy of the Hôtel des Dieux in Paris, which at the time was considered one of the best hospitals worldwide. You can here see a map of the 9th district and a lithograph what this first hospital looked like in the beginning. So many very well-known physicians have worked over the centuries here in this hospital. Just to name a few: Sigmund Freud, Theodor Billroth, Karl Rokitansky, and also a number of Nobel laureates until the 1930s. For instance, Karl Landsteiner, who discovered the blood groups here at this site. Or also Otto Loewi, who discovered the chemical synaptic transmission of nerve cells. Now, like today, people were also very much involved in infectious diseases. So infections were all over the place at that time. This went from syphilis to smallpox to childbed fever. And one, I think, very important person for medicine was Ignaz Semmelweis, who worked as a gynecologist here at the Vienna General Hospital, and who was very much interested in the disease called childbed fever. And he published this very important account on the prophylaxis of childbed fever in 1861. So he made a startling observation. So he was appalled by the high death toll that was caused by childbed fever. And you can here see a table taken out of this little booklet, where you see Department 1, where the deliveries were performed by physicians, and Department 2, where the deliveries were performed by midwives. And you can see a huge difference, a threefold difference between the death rates in the department where the physicians were responsible for the delivery. So Semmelweis thought there must be a reason for that, so he made a systematic observation and found out that there was one important factor, namely the physicians performed dissections at the anatomy department before going to the gynecology department. And so he suspected some contagion that was passed over from the corpses to the uterus wounds and caused the childbed fever, and he was right in that. And he asked his colleagues to wash their hands before performing the delivery, which was for a certain time actually done, and which also brought the death rate down to a very low level. Unfortunately, nobody really believed in the hand washing Semmelweis proposed, and he died. It was a tragic story because he was admitted to a psychiatric ward and died there under very tragic conditions very early, and all this was forgotten. But in effect, he discovered a number of disciplines, epidemiology, for instance, and hygiene, without having a clear understanding of bacteriology. So a few decades after Semmelweis, there was a new generation. You can see a picture here that hangs in the rectorate. It is the faculty in the year 1908, still in the monarchy, the Austrian-Hungarian monarchy. And you can see here a number of people who kind of shaped medicine here in Austria. One was the Nobel laureate Wagner Jauregg, but also Theodor Escherich, the discovery of E. coli, or the anatomist Emil Zuckerkandl. And they proposed an expansion of the meanwhile too small Vienna General Hospital, and you can here see on the right side the Emperor Franz Joseph when he laid the ground stone for the expansion of the building just over the street here. And so I come back to this map again, and you can here see on the top the new buildings of the Vienna General Hospital, which were essentially 4 departments: the Department of Neurology, Wagner Jauregg; Internal Medicine, Wenkebach; Pediatrics, Clemens Pirquet; and 2 departments of gynecology headed by Schauter and Wertheim. Wertheim also discovered the uterus or developed the uterus extirpation operation, which became a standard later on. So nowadays, and some of you might have strolled around in the city of Vienna when visiting our city or attending the European Congress of Radiology, you know it looks like this. So in '93, the relatively large, at the time of its building, it was the largest hospital in Europe. The new Vienna General Hospital was built here on this hill, and most of the old buildings were removed. The only one that is still present today is the Department of Gynecology, where I have my office, and we will have another expansion of our campus as we speak. So in 25 we will have a number of new buildings here at our site for translational medicine and personalized medicine as well. So coming back to history, so in 1910 the campus still looked like this, and you can here see a photo from the so-called Hospital Street with the departments of gynecology I have shown you. And also in the year 1910 something important happened here in Vienna, namely a young student, a 25-year-old student from the Kingdom of Serbia, graduated, namely Alexander Margulis' father, Raffaello. And you can here see on the right, so we went into our archives and we discovered the examination protocols. You can here see all the examinations that Raffaello took at the faculty, the medical faculty of the University of Vienna. So Alexander's father is a graduate, an early graduate of our university, and he was an eyewitness of these new buildings. So these new buildings, in particular the Department of Gynecology, looked like this. So you can here see on the right side a bedroom where also the deliveries happened. And you can see here the floor plan on the left, and I would like to draw your attention here to this red square here, which shows the laboratory of gynecology in the year 1921. So we can think back to this very interesting time. And this is what it looks like today. So the place was refurbished and is now my office. So you can here see my desk and the very old clock that is about 150 years old, and also those 2 items are kind of witnesses of that former times. Something else happened here in these rooms in 1921, which is very much related to Alexander Margulis' life, but I would not like to say everything about it. I would now like to hand over to Heidi to tell you a little bit more about her late husband, which we admire a lot. And with this, I would like to end here. I hope you found it interesting. When you come here the next time, I would also be happy to give you a little tour around our fascinating historical medical sites. And thank you very much for your attention. Thank you very much.
Unmute. Rector, Professor Mueller, what can I say but so very much thank you for this wonderful, wonderful presentation. The history of the University of Vienna is indeed inspiring, and furthermore connecting the recognition of the importance of hand washing more than 100 years ago with Alex's birth in Vienna. I think it's fascinating. And for our audience, although Alex's family lived in Belgrade, when his mother was close to her delivery date, Alex's father insisted that she go back to her family in Vienna and deliver her child at the university, as at that time, Vienna had the lowest childbirth mortality in Europe. So I think we can say history repeats, and once again, hand washing is on everyone's mind, and thanks to Vienna. And from the bottom of my heart, Rector Mueller, once again, sincere thank you. And now I would like to turn back to Professor Hricak, who I believe has another very special announcement to make. Michael?
Thank you very much, Hedy. But before doing so, let me add a few words about Alexander Margulis. In his early years, Alex could be described as a lucky star. He and his family were among the 1,000 refugees that President Franklin D. Roosevelt decided to extricate from Italy to the United States in order to protect them from Nazi persecution. In the United States, Alex graduated from Harvard Medical School, trained in radiology, and accomplished an impressive academic career that peaked when he was appointed chair of the Department of Radiology at the University of California, San Francisco in 1963. He held this position for 26 years, and he successfully made the UCSF one of the leading institutions in radiological research, clinical care, and education. When his wife, Hedvig Hricak, was appointed chair of radiology at the Memorial Sloan Kettering Cancer Center in New York City, he did not think twice and, in the golden days of his career, chose to move with her to the East Coast to become a clinical professor of radiology at the Weill Medical College of Cornell University, where he was repeatedly elected Teacher of the Year. To me, Alex was a mentor and an inspiration, and I'm proud to have been able to call him my friend. He's greatly missed, but will live on through us, our memory of him, and through initiatives such as the fellowship I'm going to tell you about. It is an honor and a privilege to announce the ESR Alexander Margulis Fellowship today, initiated by a generous private donor from the United States and installed here at the Medical University of Vienna for fellows from low and middle income countries, in particular from Eastern Europe. The initial idea for this fellowship came from friends and family of Alexander Margulis. And the idea is brilliant, I have to say, as it could not be more suitable to establish a fellowship in the name of a person who dedicated so many years of his life to supporting young people in their educational and professional journeys. One fellow every year will receive a fellowship training at the Department of Biomedical Imaging and Image-Guided Therapy at the Medical University of Vienna. Hedy, I have a question for you after this announcement. What does the ESR Alexander Margulis Fellowship mean for you personally?
Well, first of all, I think as we are celebrating this month, Alex would be 100 years old. It's the best birthday present he could have ever hoped for. As many of you know, Alex always believed that one of the most important things we can do is provide education and spread knowledge around the world. And while at UCSF back in mid-70s, so that's quite a while ago, he already started one of the world's most prominent international fellowship program. So I think that this really is the ESR Alex Margulis Fellowship is so much in line with what Alex's lifetime mission was. And I am sure he would be so pleased that his beliefs and legacy carried forward. Personally, I am absolutely delighted. And Michael, what can I say but thank you very, very much for making this dream a reality. Thank you.
Thank you very much, Hedi. I have one more question for you. It's a semi-personal question. What are the special values and principles that Alex adhered to in his leadership positions that you still personally uphold?
Well, he mentored so many of us, including myself. And I think that maybe we can all agree that Alex truly believed that you lead from behind, you serve your team. And to lead and move forward, one must show vision, integrity, courage, and respect. And one must empower every member of one's team. I so much share those beliefs, and I try my best to uphold them every day. But Alex, I think, really left a mark on so many of us, how leadership and how to lead in a very successful, friendly, empowering, empathy, and love for your people. I hope you agree.
Absolutely. Thank you, Hedi. Now I have a question for our studio guest, Christian. What does the ESR Alexander Margulis Fellowship mean for you? And do you have specific plans how to implement this fellowship at your department?
Well, thank you. This fellowship named after Alex Margulis means a lot to us. It's a great honor for us as a department of biomedical imaging to host this fellowship named after Alex, who was such a great mentor, such a great teacher, and such a great leader. And it's a privilege to host in the future the ESR Fellows, which will come from Eastern or Southeastern Europe. And for us, it's a continuation of a great tradition that we have with fellows from the region. Many of them came to work with us to learn clinical radiology, but also to perform research. And so we are proud to share not only our clinical knowledge, but also to mentor them in the sense of Alex to become clinician scientists, if you want to say so, which is a model that is not too widespread, especially in the region. So for us, it means passing on the knowledge and passing on the abilities to perform not only clinical radiology, but also science.
So much in line with all the values and principles Alex upheld during his leadership positions. I have one more question. I know, and I may disclose, that you knew Alex very well. So when did you meet Alex first, and what do you admire? What did you admire about him?
Well, I thought about this, and I met Alex first in 1988. I was shopping around for a research fellowship in the United States, and I pre-selected 3 institutions. It was Stanford, it was UCSF, and it was Johns Hopkins, based on their publications and their track record in science. So when I visited UCSF, I had an interview with Charlie Higgins. He mentored some of our colleagues and former fellows. And then with Gordon Gamsu, because my interest was chest. But after these 2 interviews, I was totally taken by surprise because Alex appeared on the scene. He asked me to join him in his office, and he spent about 20 minutes talking to me and questioning why I would come to UCSF. And he gave me some advice for the time at UCSF, which unfortunately then did not happen. But he was already in these 20 minutes becoming a mentor and a teacher to me that greatly influenced my later career. And this mentoring and teaching never stopped until he unfortunately passed away. He always had a word of advice, and he always gave me his ideas that paved the way for my clinical and my academic career.
Wow. What an inspiration in the early days of your radiological career,
Yes.
Christian.
Yes.
My dear Hedy, my dear Christian, esteemed Marcus, it was an honor and pleasure to have you here at this table talk. I guess everyone would have liked to sit together here in person in Vienna, but still, in this format, we enjoyed it very much, and I hope everyone who is tuned in enjoyed this table talk as well. What a celebration of the life of Alexander Margulis. Ladies and gentlemen, I wish you a wonderful second day of the ECR 2021. Stay safe and see you soon again.
Thank you. Thank you, Michael.
Thank you, Michael.
Bye, everybody.